Hey guys, today we are going to talk about stretches for your hips, especially great for pelvic floor tightness, urinary incontinence, tight hips, and if you get achiness in kind of that lower quarter of your body. So stay tuned. Okay, so what you're gonna need is a couch or a chair or the edge of your bed or anything you can basically sit down on without arms or with wider arms so that you can get your hips in a good position. So again, I'm gonna use my couch. So you're gonna sit down here and you're gonna bring your leg into that figure 4 position. Now, the important part with this stretch is that you're not kind of slouched back here. You really, before you even bring your leg up, you really want to tilt your pelvis forward so your pelvis is more in a neutral position, but your back is a little bit neutral to a little bit arched, okay? Because you don't want it to be flat or rounded. So sit up nice and tall, grab that leg up. It's gonna be harder to pull it up with a neutral spine. You're gonna flex this foot down here, which is gonna protect your knee joint. And the first stretch we're gonna do is for your obturator externus. It's just gonna be in your piriformis. It's just gonna be your figure 4 typical stretch set. So what you're gonna do, push this knee towards the ground. So hold every stretch for 30 seconds. Again, what you want to make sure is both butt cheeks are on the couch or your seated surface and you're sitting up nice and tall. And what you want to think about, especially if you're doing this for pelvic floor tightness, you want to try to relax that pelvic floor muscle while you're breathing in. You want to breathe in from your belly, expand your belly or kind of push your belly out while you're breathing in, and allow that belly to relax or go back in when you're breathing out. So as you are doing this, especially if it's for pelvic floor tightness, which is what I do it for, is you're going to breathe in, extend your belly out, and feel that pelvic floor relax, kind of that elevator go towards the ground. And then as you exhale, that elevator will float back up, and you can kind of work both on pelvic floor relaxing while you stretch your hip muscles, okay? So that's about 30 seconds. We're gonna switch legs. Again, you wanna kind of sit up nice and tall, flex this bottom foot, and you're pushing. Oh, this is definitely needed. I did yoga this morning, but it's still always have tightness in these hips. My left, for some reason today, is more tight. So again, I'm pushing it towards the ground, extending my belly and trying to focus on that relaxation of that pelvic floor. As I breathe in, the pelvic floor drops. As I exhale, it returns to its neutral position. And so again, you want to hold this for 30 seconds. And this is the pretty common one. The next stretch we're going to do is for your obturator internus, and that muscle focuses more on tightening the pelvic floor. It really works with the pelvic floor muscles, and so strengthening it can strengthen the pelvic floor muscles, and stretching it can also relax or stretch the pelvic floor muscles. So that is awesome. And basically what you're gonna do is same thing, sit up nice and tall, flex that pelvis forward. Instead of pushing your knee towards the ground, you're gonna pull it up towards your opposite shoulder, okay? So you're gonna pull it towards your opposite shoulder. You're also going to keep that bottom foot flexed in good posture. And you're going to breathe in, focusing on how your pelvic floor raises and relaxes. Now, if you're not doing this stretch for pelvic floor tightness, it's also really good for runners or just general athletes so that you can have good hip mobility and that your pelvic floor isn't like a rock so that it can help your abs engage and your whole body just work more efficiently, because a lot of times injuries happen, or pain and things like that happen because your body is not moving as efficiently as it's supposed to, and there's more friction and more stress on different areas than there should be. Okay, we're gonna switch. This is really good for me because I haven't done these stretches in a while. Oops, life's just been busy. It's the Christmas season over here. So again, figure 4, good posture, pulling towards the opposite shoulder. So this is my left leg. I'm gonna pull it towards my right shoulder in a diagonal position. And just breathing in, holding it for 30 seconds. All right, so there you guys have it. Your obturator internus, externus, piriformis stretches that you can use for hip tightness, pelvic floor tightness, and other things. If you haven't yet, please subscribe down below and make sure that you share this video with a friend who also maybe like you has tight hips or has been dealing with pelvic floor tightness, urinary urgency, things like that. I hope you guys have an awesome day.